to Medical English for Diabetes Specialists, your audio guide to mastering clinical communication. In this podcast, we will review the essential points from our first 4 lessons, focusing on key vocabulary, grammar rules, and communicative sentences vital for your daily practice. Prepare to strengthen your language skills in a calm and conducive learning environment. Let's begin with the first lesson, introducing yourself as a specialist, where we explored the importance of clearly introducing yourself and describing your specialization. The vocabulary we covered is fundamental for establishing contact with your international patients and colleagues. Key vocabulary to remember: chronic disease, a long-lasting illness such as type 2 diabetes. For example, diabetes is a chronic disease that requires long-term management. Insulin resistance, the reduced response of body cells to insulin. Obesity often leads to insulin resistance. Blood glucose, the amount of sugar in the blood. I monitor blood glucose levels regularly. Medication adherence, taking prescribed medications correctly. Successful treatment depends partly on medication adherence. Cardiovascular complications and renal complications, problems related to the heart and blood vessels or kidneys, often associated with diabetes. Poor treatment adherence may increase the risk of cardiovascular disease. Lifestyle modification, changes in daily habits, essential for diabetes management. We also reviewed the present simple, a crucial tense for describing scientific facts, professional routines, and permanent situations. Remember, for scientific facts, diabetes affects millions of people worldwide. For your routines, I treat patients with diabetes, or I monitor blood glucose levels regularly. For permanent situations, I work in a private clinic. Communicative sentences for daily practice. Where do you work? I specialize in internal medicine. What diseases do you treat most frequently? Moving on to the second lesson, taking medical history, which taught us how to gather a comprehensive medical history. This is a fundamental step for personalized care. Key vocabulary to remember: medical history, the patient's past illnesses and treatments. Before prescribing treatment, the physician reviews the patient's medical history. Family history, medical conditions affecting close relatives. Obesity is common in his family history. Chief complaint, the main reason the patient seeks medical care. The patient's chief complaint is persistent fatigue. Symptom, a problem experienced by the patient. Fatigue is often the first symptom reported by diabetic patients. Allergy, an abnormal reaction to a substance or medication. The patient reports an allergy to penicillin. HbA1c, a blood test showing average glucose over the previous 3 months. The patient's HbA1c is 8.5%, indicating poor glycemic control. Follow-up, a later medical visit to assess progress. Communicative sentences for daily practice. Are you allergic to any medications? Have any members of your family had diabetes? When did your symptoms begin? Our third lesson, explaining diagnoses, focused on how to explain complex diagnoses, such as type 2 diabetes, clearly and understandably to the patient. We also explored new treatments. Key vocabulary to remember: hormone, a chemical messenger produced by glands. Insulin is an important hormone. Pancreas, the organ that produces insulin. The pancreas releases insulin after meals. Appetite, desire to eat. Semaglutide reduces appetite. Metabolism, the body's process of converting food into energy. Thyroid hormones regulate metabolism. Side effect, an unintended effect of a medication. Mild nausea is a common side effect of GLP-1 receptor agonists. Nausea, vomiting, diarrhea, and constipation are common gastrointestinal side effects. Some patients experience nausea during the first weeks. Weight loss, reduction in body weight. Weight loss improves insulin sensitivity. Communicative sentences for daily practice. Fatigue is a common symptom of diabetes. Insulin is a hormone produced by the pancreas. Mild nausea is a common side effect of GLP-1 receptor agonists. Finally, the fourth lesson, choosing the right treatment, highlighted the importance of individualizing type 2 diabetes treatment, taking into account each patient's unique characteristics. Key vocabulary to remember: individualized treatment, a treatment plan designed specifically for one patient's needs. The physician recommended individualized treatment because every patient has different medical needs. First-line therapy, the preferred initial treatment for a disease. Metformin remains an effective first-line therapy for many patients. Glycemic control, control of blood glucose levels. Semaglutide has demonstrated excellent efficacy for improving glycemic control. GLP-1 receptor agonist and SGLT2 inhibitor, classes of medications that improve glycemic control and offer cardiovascular and renal benefits. Dose escalation, gradually increasing the medication dose. The physician used gradual dose escalation to reduce nausea. Contraindication, a reason why a treatment should not be used. A severe allergy to a medication is a contraindication. Efficacy, the ability of a treatment to produce the desired effect. Several studies have demonstrated the efficacy of semaglutide. Shared decision-making, a process in which the doctor and patient make treatment decisions together. Modal verbs are essential for giving recommendations and discussing treatment options politely and professionally. Let's recall their usage. Should, for advice or recommendation. Patients should exercise regularly to improve glycemic control. Must, for strong obligation or necessity. Patients must monitor their blood glucose regularly. May or might, for possibility. Semaglutide may cause nausea during the first weeks. Can or could, for ability or possibility. Semaglutide can improve HbA1c. We hope this review has been helpful in consolidating your knowledge. Remember that regular practice is the key to mastery. Continue to explore, learn, and communicate with confidence. Thank you for listening to Medical English for Diabetes Specialists. See you next time for a new lesson.